Hello, everyone, and welcome to the Being with Bella podcast. My name is Isabella, but I also go by Bella. And if you haven't noticed already, I renamed the podcast. There's more about that on my Instagram if you're curious as to why. Today, I have a very special guest with me here today, my third guest. I have my lovely friend Josie with me.
Hi, I'm very excited to be here.
Yeah, thank you for being here.
Yeah, thanks for having me.
We're so formal. Today, we are going to talk about therapy and mental health and our personal experiences with that journey. I was thinking that we could start off by talking a little bit about just our experience with finding the right therapist and our kind of initial realization, which I think we would have very different experiences with this, but like our initial realization, like, I think I need to go to therapy or would like to start going to therapy. I think that would be something that'd be interesting to talk about. Would you like to start off? I mean, I'd love to hear about your
Sure.
experience with that.
Yeah, so Bella and I were just talking about this a little bit before we started recording, but I really wanted to touch on how therapy really can be for everyone and anyone,
Yes.
and not just people who feel like they maybe have had something really traumatic happen to
Mhm.
them, or, you know, I feel like it might be common to think like, oh, well, I don't need therapy, but it can really benefit anyone.
Yeah.
And I think we do want to talk maybe later about the stigma and how that's kind of
Yes,
unnecessary
for sure.
because there's so many benefits.
Mhm.
Um, so I want to get that out of the way. I have maybe a unique experience with therapy because, as I was just telling Bella, I've been in therapy kind of my whole life.
Mhm.
I've had maybe 5 or 6 or 7 therapists in my life.
Wow.
And it can be really hard to find the right one. It's kind of like
Definitely.
dating, honestly.
It really is in a way.
Yes, no, you have
Yeah.
to like yeah, you have to meet people and
Yeah.
see what works.
Right.
Um, I started going to therapy super young because my mom was concerned with like how I was like basically me getting along with other kids in the playground
Oh,
when I
okay.
was in 1st grade.
Okay.
Because I went to, like, a really tiny school,
Mhm.
and there was literally one other girl in my grade in kindergarten,
Oh, wow.
and
So only
then
2 girls.
only 2 girls,
Wow.
and we were besties,
Uh-huh.
and then come 1st grade at this tiny school, there was, like, 6 girls,
Okay.
and apparently at that age, I was, like, showing a lot of, like, jealousy or, like, I didn't understand
Mm.
why my best friend wanted to also be friends with the other girls.
Yeah.
So my mom brought me to first it was the school psychologist.
Mhm.
Crazy we had one at such a small school like
Yeah,
that.
that
But
is.
yeah, and I looking back, I'm really grateful that I was brought to then from there I was brought to a therapist at like a practice.
Yeah.
Um and and so on and so forth. I'm really
Mhm.
grateful that I was put in therapy
Yeah.
from a young age, but it also creates this like
No, you're
double
fine.
thing in my mind where on one
Yeah.
hand I'm grateful, but on the other hand, it like gave me this feeling of like, oh well, something's wrong with me.
I totally empathize with that feeling.
Yeah.
That's huge. Yeah.
Yeah. Like I would go to my mom with stuff that I thought was just kind of normal kid stuff.
Yeah.
Oh, my friends and I are fighting and I'm 10.
Yeah.
And she'd be like, "Oh, well, I'm not qualified. Like, we need to talk to your therapist." I mean, of course, those weren't her words, but that
Right,
was
right,
the
right.
message.
Yeah.
So yeah, kind of a double-edged sword, and I wanna clarify that everyone in therapy is not there because there is, quote, "something wrong with them." That is
Yes.
absolutely not the
That's
case.
huge. That's huge.
Um, but that was how I felt
Yeah.
a little bit growing up, and I can talk about the different therapists I've had.
Yeah.
Um, I had one for quite some time, actually went back to her years later,
Mhm.
but I now refer to her as the talker. This woman, very smart, but
Yes.
she would just talk, and,
Okay,
like, to the point
interesting.
where I remember sitting in session
Uh-huh.
and, like, zoning out and, like, trying to, like,
Wow.
um
You guys can't see, but my jaw just dropped.
yes. Um, I was literally, like, doing the thing you do sometimes in class where you're trying with every muscle to, like, look like an active listener and, like, nod and, like, be like, "Mhm, mhm."
Yeah.
So that's why I call her the talker because I would be like, "What are you even talking about?" She would just
Yeah.
go on, uh,
What did she
tangents.
talk about? Like herself or
No, I don't remember.
okay.
But I think it was like I would, express some issue with
Yeah.
something,
Yeah.
and I think she would almost just start like analyzing or like giving her therapeutic advice.
Right.
I don't know if that's the right phrase. She'd be giving her advice, but
Mhm.
then just go on and on and on and on
Okay.
and on and on and on.
Wow.
And yeah, I don't really remember much of what it was she
No,
was
that's
saying.
fair. Yeah.
And then my next therapist was the listener.
Oh, so you had both
Yes.
ends of the spectrum.
And I really liked the listener because it was a
Okay.
total breath of fresh air where I
Right.
was actually being listened
I
to.
can that's a big part of therapy.
Yes, actually got to speak in talk therapy, imagine that. Yeah, but the issue with that therapist was that she was a little bit she was very opinionated.
Oh, okay.
And at the time, she was empathetic, of
Yeah.
course, but at the time I had some things going on in my life and I was like, everyone I know feels this way about this issue
Yeah.
and I feel the opposite.
Okay.
And that actually still is very like lonely for me.
Yeah. I
As you
get
would
that.
imagine.
Yeah.
Yeah. And the listener would kind of be like, "Well, I'd feel the same as everyone else."
Really?
Yeah, like I would tell her and I'd be like, "Oh, this made me sad." And she'd be like, "I'd be pissed off if I heard that."
Wow.
So that didn't help.
Yeah.
Or of course, I have been in therapy a lot for my anxiety.
Yeah.
Um, I do have a diagnosis, which I think we want to touch on as well. But my current therapist calls this like a motherly approach to anxiety.
Mhm.
Of like, I'd say, "Oh, I'm anxious about school." I was in high
Mhm.
school at the time, and she'd be like, "Well, do you always get your assignments in on time?" I'd say, "Yes,
Mm.
I do." And she goes, "There, then you don't need to worry about it because you always get it done."
Wow, I'm noticing a lot of things I don't like.
Yes, yes. Yeah, and my current therapist, called that, like, kind of a mothery approach to
Yeah.
anxiety,
Wait, I
which
love that you've talked to your another therapist about this. That's
yes.
awesome.
No,
Yeah.
definitely talk shit with your new therapist about your old therapist, I do recommend that.
Wait, I'm gonna do that next time.
Yes, it's healing. No, and the thing too is therapists can be wrong, right?
Yeah,
We're all people.
right.
And I've relayed some things I was told to my current therapist,
Mhm.
and some of the things she's even called appalling.
Appalling, wow.
Yes. Yes. So I guess that goes in line with like question everything.
Right,
If anyone says something to you that really bothers you, you don't have to believe it
right,
and take it as like the law,
right.
even if it's a therapist.
Mhm.
But that brings me to my current therapist who I've been with for um since my freshman year of college, and
Okay.
I'm in my last semester of college.
Time
So
flew.
time flew,
It's
I don't know, 3
crazy.
years or something. And I'm so blessed to have her. She's actually on maternity leave right now.
Oh, she's
So,
still I
yes.
see,
Yeah,
okay.
she's coming back in a couple weeks, but she is
Yay!
amazing. Just the perfect balance of empathy. She listens, but she has advice and she's so knowledgeable, and I guess her and I just click. She thinks I'm
Yeah.
funny.
That's important. I mean, they gotta match your humor. It is
Yes,
it is it
yes,
is in a way like dating. I will yeah.
yes. So, yeah, I guess the my takeaway, and of course there was been a few others that were not noteworthy, but my takeaway is if you say I'm gonna try therapy and you are in the room with someone and you're like, this is not it,
Yeah,
that doesn't mean that therapy is not it.
right.
It's probably just not the therapist for you.
Yes.
But that was a lot of talking from me.
No, you're totally good.
And Bella,
I learned so much
yeah,
already.
yeah, I
Yeah.
want to hear like your journey and
Yeah,
what
for
you've been through.
sure. Well, before I get into my journey, I just wanted to mention something that I think is important to keep in mind if you are considering going to therapy or if you are in therapy. A lot of what Josie was mentioning about the therapist that she didn't love or didn't have the best experience with is that it seemed like they kind of had their own opinions about what
Mhm.
she should do and their own opinions about like what is the correct way to think about
Mhm.
things and the correct way to view things. And a huge thing about therapy, which is something that I love so much about my current therapist, is helping you develop that trust in yourself to have your own opinions and your own feelings about situations. And
Yes.
something that's so huge that I love about my current therapist is she always is asking me, "What do you want?" It's like the
Mm.
notebook. What do you want? Like she's always asking me that because that's what matters in the end. It's
Yes.
like cultivating that trust in yourself to make your own decisions that align with your morals and your values. That's what it really comes down to.
My therapist brings up, like, "Let's go back to your values," maybe more than I wish
Yes.
she would, but,
No,
um,
that's huge
I
though.
completely agree.
Yeah, for sure. I first started going to therapy my sophomore year of college. I just started to experience heightened anxiety. I My hypothesis, this is not like a fact, but my hypothesis is that it was because I got a pretty brutal concussion freshman year, and I did some Googling, as I do, and I found out that it can actually like alter your brain chemistry in a way that like heightens anxiety. I've always been like, a little bit anxious, a little bit nervous, like more on the nervous side, but it's never been this bad
Mm,
to the point where like I was having like panic attacks. So it got to that point and I was like, well, this is not like normal. Like this is starting to get in the way of me like functioning normally and living my life normally. So that's kind of why I was like, I think I should maybe talk to someone. Like it's free through the school, like I have nothing to lose. So then I met with my very first therapist. I don't really have anything negative to say about her, but it didn't have the biggest impact on me positively either. I came to find out though towards the end of our time together that she was going on to specialize in eating disorders. And I was in therapy for anxiety. And so I think that's kind of where part of the disconnect was, is like that
mm,
just wasn't her niche, that wasn't her specialty. One of the things that is still in my brain that she said to me is one time she was like, anxiety is exhausting. Like obviously super validated here.
mhm,
Like very
it
validating to
is.
like have
Mhm,
that validated because it is exhausting. But at the same time, it's like, well, I already knew that. Like, what do I do about it? Like, how do I stop this? Like, what can I change in my life or about
mhm,
myself or about my thinking? Which now I know it has a lot to do with like your thinking patterns, but that took me a while to learn. Like, what can I actually do about this? Like, I already know that it's exhausting. That's why I'm here. So that was like a little bit of frustration. No hate to her. She was a very sweet lady. Everything's a learning experience. Like I've decided that I want to be a therapist one day. So like having these experiences is awesome to like learn about ways that I would want to practice in the future. So
mhm,
that was my first therapist, and then my second therapist I was with for a bit longer. I want to say about a year I was with her. Um and she was slightly more helpful, but I really think, not to toot my own horn, but I really think a big part of it is because I came into therapy and I was like, okay, here's what's happening. Here's what I want to figure out. Here's what I want to get done. Like, I was very like type A about it. I was
I'm the
like,
same way.
yeah, I was like, this is my problem. This is what we need to do. We need to get to the root of this anxiety. We need to figure this out. I'm done living this way. Like, let's cut this out. And so we did that. We got to the root of my anxiety per se, but then we were stuck there. So
Mm,
every time I would bring up a problem, I would be like, oh, well, I'm anxious or nervous about this. And she'd be like, oh, well, this connects back to the root of uncertainty, which actually connects to OCD, which I found out later that I have. Anyways, we'll get into that later. But she was like, oh, well, this one connects to that root of uncertainty, or this one connects to that root of being unsure. Like a lot of it was like being unsure about things, like
mhm,
not trusting myself or like being uncertain or unsure. And it was helpful to know the route, but then once we got to that point, it was like a dead end again.
mm.
So slightly more progress with that therapist. She was a fun lady. Like no again, no hate to any of these people. Like it was a learning experience for me. Hopefully they don't listen to this. I'm getting paranoid now. Um
Don't engage with the thought.
yes. But yeah, then that brought me to my current therapist who is my bestie. I love her. The way that I got into contact with her was I was dealing with a lot of mental health struggles and just lots of like racing thoughts, not able to like focus on anything because of how heightened my anxiety was and how distracting it was. And I did a lot of googling and around like the specific like thoughts I was having too, and I read a little bit about OCD. And I was like, okay, maybe I have OCD. Maybe I should go to a therapist who knows more about this so I can figure out if I have this or not and get the proper treatment for this. I was on the phone with the guy, the mental health intake guy, and he was like, "So, what's going on?" Oh, this is just a funny thing that I want to share.
Oh, no.
But he was like, "So, like, how does the anxiety manifest for you?" And I remember I was like, "In a lot of ways." And we were just him and I were just having such a good cackle together. It was a good time. Like, a big tip, making humor out of it, so real and so helpful. Like, I was not annoyed at all that he was laughing with me. Like, it honestly made
Mhm.
me feel less alone, made me feel more comfortable. So that guy was great. Already was getting good vibes that, like, okay, I'm on the right path because he's just like making me feel more normal and comfortable. But then I was like, okay, could I like have a therapist that like specializes in OCD just because I think I might have it. And so he got me set up with one, and since then, we have been doing treatment for both OCD and anxiety.
Mm.
I have not gotten an official diagnosis, and I don't know if I ever will try to get one. Um, but the treatment for OCD is very different from talk therapy. Talk therapy is very ineffective for OCD because something that happens with OCD is people will go to friends or go to Google or go to some external source for reassurance about the thing that they're uncertain about. And then that will temporarily relieve the anxiety that they're having about the uncertainty, but then the anxiety will come back. So a huge thing with OCD is not reassuring yourself and not seeking out that reassurance and just sitting with the uncomfortable feeling of like, this is uncertain. I don't know if this, like, I don't know the answer to this question. Um, and so one of the exposures that my therapist actually did for me was, okay, well, you're uncertain about if you have OCD or if you don't have OCD. You're uncertain about that. So, as an exposure, we're not going to tell you if you have OCD or not
Fair
because you can't be
enough.
certain about it.
Okay.
I'm doing the treatment for it.
Mm.
So, treatment for OCD and anxiety because it's definitely like a combination. But
Mhm.
so yeah, that's where I'm at, and like I said, I really love my new therapist because she's helped me gain so much trust in myself. Um, Even when I've been in like situations that weren't healthy for me, like with relationships and things,
Mm.
I still really appreciate that she encouraged me to do what I wanted to do because without doing that, I would never have gained trust in myself and learned on my own from my experiences, and I think that's an important thing to do. I think to some extent like taking advice from other people is very helpful, but I think prioritizing that advice over your own instincts and your own values can really sometimes ruin your self-trust, and
Mm.
self-trust is so crucial to have, especially like with the age we're at and like where we are in
Mhm.
our lives.
Mhm. Creates,
um
like, a disconnect within
for
you.
sure, and
Mhm.
that's like a huge part of like having a healthy relationship with yourself is having that trust with
Mm.
yourself.
Very
That's
important.
Yeah. But that's my little background about therapy. I'm in a good place with my therapist now. Yeah, she's helped me a lot. I feel like the most growth I've gone through honestly has been these past 6 months. Yeah, with her. So,
That's awesome.
yeah, it's been good.
Yeah, it can be frustrating because a lot of times, like, progress isn't always linear.
Yes.
And I'm sure, like, you guys have heard that before.
Yes.
And so you can yeah, obviously we all go through different seasons of life and we deal with different things.
Mhm.
And I love therapy because it's nice just to have someone there.
Right.
Like, say, heaven forbid, a crisis happens,
Yeah.
therapy.
Right.
But also, if it's a just kind of a blah week and maybe I
Right.
want to talk about some drama in my life, like,
Yeah.
I have an outlet for that
Right.
that is completely confidential.
Right.
So that's also a great thing
Yeah, for
about therapy.
sure. It doesn't have to be like you're in this like midlife crisis. Like
Mhm.
it's really just about having someone there who you can, bounce your thoughts off of and cultivate like a better understanding of yourself with.
Mhm.
Just having like that support system that's confidential, I think is so huge.
Mhm.
And something else that I noticed in my therapy experience is for a long, long time, I would just be itching to get to the next therapy session. Like itching, and every time I felt anxiety or felt uncomfortable about something, I would just be itching to get to the next session because I didn't have that trust in myself to handle those problems on my own. And so I would just be so reliant on therapy to the point where I couldn't solve quote unquote
Mhm.
because life is not a problem to be solved. That was part of the
Mm.
fault in my thinking pattern. But yeah, a huge thing was I was realizing I was always just itching to get to the next session and itching to get that reassurance, which is also part of what makes me think it is partly OCD. At least it is all like a spectrum.
Right.
But yeah, so that's also a huge thing is it's great to have a therapist, to reflect on yourself and introspect with, if you will, but also not becoming so dependent or reliant on it that you can't make decisions and like live your life without talking to them first. And like
Mhm.
it's almost like getting approval from like a parent or something. It's
Mhm.
like you have to be able to have that self-trust, which don't put pressure on yourself to instantly have that, because sometimes it depends on the person, but sometimes going to therapy is a huge step to developing that self-trust. So
I
yeah.
think that's a great point. I definitely empathize with, like, itching to get to the next
Yeah,
session,
yeah.
and that yeah, I've totally, had to come to terms as well with, like, sometimes you do just have to make your own decisions,
Right.
which is fine for
Yeah.
me, but also I, for some reason, am also a huge person who, like, seeks, like, approval of authority figures, and I
Mm,
definitely seek that out of my
yeah,
therapist.
that's fair.
I haven't
I get that.
spoken with her about that yet, but maybe we should have a conversation. She'd
Yeah.
be interested to hear that.
Yeah.
Um, Another thing I wanted to add
Yeah.
about, like, finding a great therapist, like
Mhm.
I have, and it sounds like you have,
Yeah.
is my therapist always reiterates that, like, our session is whatever I want it to be.
Yes.
So that takes away the pressure of, like,
Right.
oh, I need, some, like, psychoanalytical or, like, some traumatic event. Like,
Yeah.
I have shown up to therapy and just ranted and
Mhm.
been like, "This is a shitty situation, pardon my French. There's no solution, really. I just need to rant about this," and
Yeah.
it's like, "Go for it," and I
Yeah.
just can rant,
Right.
and, or on the other hand, like, I had a session where I genuinely had nothing to talk about, which, I mean, good, right? Because
Yeah.
nothing was bad in my life that week, but we ended up it made sense kind of. We were exploring some of the things that come up regularly for me.
Mhm.
I guess we were kind of exploring, like, where do you think that comes from?
Yeah.
And which is again a good thing to do sometimes.
Yeah.
And I was like, you know what? I read this book about evolutionary psychology, and
Mm.
I yapped for the next 45 minutes about the evolution behind my issues.
That's awesome. Wait, I love
It was
that.
I thought it was iconic
That sounds like a
personally.
fascinating conversation.
I You know what? And, like, my therapist, God bless her, because if she was bored, I had no idea. Like,
Oh.
she is such a good active listener, and
Yeah.
she, like, seems to be actually really intrigued, and
Yeah.
especially, like, I'll tell her about, like, a study that was published in the book or, like,
Mhm.
mentioned the book, and she goes, "Oh, wow." Like, she's actually learning something too, and I'm like, "Yes."
That's part of why I'm so excited to be a therapist. I'm gonna learn so much from my
Mhm.
clients. I think that's awesome. Yeah, that's great. I love that.
Yeah, no, definitely be a therapist for kids with really niche interests that read way too many books about it, because they'll just
Can I be a
yap.
therapist for your kid?
Yeah, I think we can set that up.
Perfect. Call me in 20 years.
Yeah, no, literally. Lord
Oh.
knows they will need it.
Oh. Anyways. Yeah, no, I think that's a huge thing. I also relate to that with my therapist. Like, I would notice in the beginning when I was seeing this new therapist, I would always be like, okay, well, I wanted to talk about this today. Like, I had this plan for what I wanted to talk about, but I actually find myself naturally speaking about something else. And then
Mhm,
I was getting anxious because I was like, well, no, I was supposed to talk about this issue, and I didn't want to talk about this. And she's like, well, no, it's your session. This is for you. You talk about whatever you want to talk about. Like, what do
mhm.
you want to talk about? What would be helpful for you? And I think that's super huge. So I'm glad your therapist does that too.
Yes, yeah,
Yeah.
her amazing line is, and we can, like, if it's the end of a session, it's like, "We can talk about this next week if this is still relevant for you."
That's awesome. I love that.
Mhm.
I love
Yeah, write
that.
that down, Bella.
I will.
Yes. So Bella just mentioned a couple minutes ago about how she and her therapist decided not to look into a diagnosis for OCD, which is so valid. And I wanted to address my experience with diagnoses.
Yeah.
Because for me personally,
Mhm.
they've been very validating.
Yeah.
But I remember when I was first asking for a diagnosis, my therapist was very, I don't want to say hesitant, but she was very like, really, if this is only if this is helpful for you.
Yes. Mhm.
And she was like, you don't need one.
Yeah.
And so I want to be very, I don't want to mince words about that it's a very personal choice and
Yes.
people relate to that concept very differently.
Yeah, for sure.
My personal experience is just that it's super validating.
Yeah, which is important. That's
Yes.
huge, yeah.
Yeah, so for our listeners, I have generalized anxiety disorder. My therapist and I talk about some OCD tendencies. I
Mhm.
do not have a diagnosis for that. Honestly, it's not something I feel the need to pursue
Yeah.
because I'm already medicated for anxiety
Yeah.
and they're similar, which also might be an
Similar.
interesting thing to
Yeah.
talk about later, but they're similar or even the same sometimes medications
Yes.
for the two of
Mhm.
them. So
Yes.
it does come up for me, but even taking that a step further, when I'm having, anxiety beyond the point of what a normal person would have, which
Yeah.
by the way, God bless my a roommate I've had. I don't can I call people out specifically on the podcast?
Yeah.
A roommate, a dear, lovely, amazing roommate I've had who I don't know if she'd wanna be named, but she was the first one to mention possibly getting medicated to me. And yeah, that's also a very personal topic that, we can come back to, but before she said that, I was just like, "Oh, well, I have anxiety, but, like, everyone has anxiety."
Mm, yeah.
And it's true, everyone
Yeah.
experiences some level of anxiety.
Yes.
Um, Mine was kinda like Bella mentioned, actually getting in the way of me living my life and, like, functioning normally and all of that good stuff.
Yeah.
So, just super validating for me to think of myself as having um, anxiety, but even further, if I'm having like a really bad day or a bad moment or
Mhm.
whatever, what I've started doing, and again, this works for me, maybe not everyone, maybe I'm weird. Just kidding, no one is weird with their, their anxiety. But I go a step further to say, well, I have an anxiety disorder
That's
because that's
fair.
what validates me. Because
Yeah.
again, whenever it's like I wouldn't want to go around and be like, "Oh, well, I have anxiety," because everyone does, which again, you can if that's you,
Yeah.
but for me, it's like, "No, no, 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 Josie, you have a disorder. You have an anxiety disorder," and
Yeah.
that is just what helps me validate myself and
For
my
sure.
feelings.
Yeah, no, that's awesome. I think that's great that you were able to, like, figure out that that was something that's important to you and, like, validating
Mhm,
for you, and I think, yeah, what's most important is, I guess, just, like, reflecting on, like, what about the diagnosis will be, like, helpful for you. And so
mhm,
for me, I was very anxious to get a diagnosis, but at the same time, I knew that I was always going to have my tendencies and my anxious moments. A friend of mine from the past actually mentioned something that was really helpful. Well, helpful, but also invalidating at the same time. I think in the moment it was invalidating, but reflecting back on it,
mm,
it is it is helpful to think this way, but I think it's a little bit more complex than the way he described it. But what he kind of said to me is, "Don't think of yourself as someone with anxiety." Josie's making a face. Don't
Ignore any face I make
Well,
ever.
yeah, well, when I heard this at the moment, I was not it was not the most helpful thing to hear, but reflecting back on it, not identifying myself, and this is my personal experience, like, everyone has a different experience with this. What he was essentially trying to say was not identifying myself as I am an anxious person, saying, like, "You're an anxious person." It almost gives more power to that anxiety, and you're like, "Oh, well, that's just how I am, so I'm just always gonna be that way." And for me, I wanted to identify less with that part of myself and give less power to that part of myself. I guess I approach it from kind of like a spiritual perspective. But yeah, I didn't want to like give as much power to that part of myself. I don't necessarily need a diagnosis if the treatment and what I'm doing is helping me and effective for me. I totally, like, understand your perspective as well, and I think that it really is just specific to the person and their experience with it. We also have very different backgrounds with it. So, like,
Mm,
I started going, like, 3 years ago to therapy, and you've
mhm.
been in it for most of your life, so
Yes.
it really is personal to your experience.
Yeah, no, I
But
totally see your perspective on that too. It
yeah.
it totally makes sense. The giving it less power. Maybe I
Mhm.
should try it.
It's
Um,
so much easier said than done, though.
I mean, honestly, a lot of things in therapy are, but it's okay because we work on them.
Yeah, yeah,
Yeah, so kind of on that note, I wanted, since I mentioned medication,
yeah.
um, another hugely personal decision.
Yes, for sure.
Everyone is on their own journey with that,
Yes.
and be skeptical if anyone is trying to push you one way or the other on that
Yes,
decision because
definitely.
it's very
It's a
personal.
personal decision. Yeah.
Absolutely. That all being said, that's my disclaimer. I've had really amazing experiences being medicated for 2, almost 3 years now.
Mhm.
I'm on Lexapro, if you're wondering, for anxiety. I feel like there's a lot of concerns that come up, like, "Oh, I'm gonna lose myself," or "I'm not gonna feel like me," or, things along those lines,
Yeah.
and I do just wanna put out there that I've not experienced any of that
Mhm.
personally.
Me neither.
I'm very much myself, but
Yeah.
just if anything, and this is really, again, in my opinion, this is what medication should be, I'm more myself
Yeah.
because I'm not locked up inside my head
Exactly.
panicking about every little thing,
Right.
or having panic attacks all the time.
Right.
I do also have I call it my panic pill.
Mm.
It's a really, like, chill in the moment,
Yeah.
medication as well. So yeah, I just wanted to kind of put that out there that you can have really positive experiences with really low side effects,
Yes.
getting
Definitely.
medicated for anxiety. So it's definitely an option.
Yeah.
And I feel like it might even have more stigma than therapy in
It
general.
might.
And I just, so that was my reason for bringing it up, is because
Yeah.
the stigma is unnecessary, although
Yeah.
it is still a personal decision. But I just kind of wanted to shout that out.
Yeah, thanks for bringing that up. I also agree that the comment you made about making you feel more like yourself, I also
Mhm.
very much resonate with that.
Mm,
And I think that's a huge thing to make note of is that's kind of what can help you distinguish like if which direction you want to lean with medication almost. Obviously, I'm not a psychiatrist or anything. I'm just stating my opinion, but
mhm,
I think it's huge to like reflect on like, well, how much is this truly impacting my life? Is it to the point where I think that doing something to alleviate some of this anxiety would give me that extra push I need
mhm,
versus, well, it's only really happening every once in a while. It's not that extreme for me. But
mhm.
yeah, I guess I was thinking we could transition into health anxiety now.
Mhm. It's a big one for me and Bella.
Yes, a huge one that we really bond over because it's a struggle. It's definitely a confusing experience because for me, as someone who's had concussions in the past, as someone who has asthma, as someone who has really large tonsils, I've always just been, and this has also worsened as my anxiety symptoms have worsened, but I've become more hyper aware of just like my bodily sensations,
Mhm,
especially related to those health conditions, you might say. I would really become hyper aware of any sensation I was feeling. I had a phase where I was terrified to hit my head because I was like, if I hit my head, I'm gonna reconcuss myself.
mhm.
People hit their head all the time, like babies hit their head, like they're fine.
I understand where that was coming from.
Anyways, people hit their head all the time and like they don't get a concussion every time they hit their head. But in my head, it was like, no, if you get the slightest hit to the head, you're gonna have a concussion. And when that would happen to me, I would spiral and I would convince myself I had all those symptoms of a concussion.
Mhm,
And so that's just one example of like a health anxiety experience that I've had.
mhm.
But I'd love to hear more about yours.
Yes, so I'm going to, because I could probably talk about this for 2 hours, and I won't don't wanna subject anyone to that. Um, but, where do I even start? The thing with, well, for one, I have been disallowed from Googling any symptoms.
That's huge, yeah.
I am not allowed to Google symptoms. Um, and honestly, that was good for me. When I first
Yeah.
heard that, I was like, "What? Then how do I know which way my life is about to end?" Um, but that is I would recommend, and, throughout the years, I've had some incredibly intense episodes, of and, like, the classic things, like, oh, the anxious person thinks they're having a heart attack,
Yeah.
but when you're in that moment, I get, somatic, symptoms, which just
Mhm.
means, like, somatic is, like, something you feel in your body.
Yes.
So very real feelings actually in
Yes.
my body of, like, really intense chest pain,
Yeah.
and in that moment, I would have, like, my mom be, like, my conduit who, like, she could look it up, so if something was really happening, we
Yeah.
could go to the hospital, but,
Yeah.
uh, spoiler alert, nothing I was never having a heart attack. This is crazy. In my experience, my little brain choo
Little? You're so humble.
my little brain chooses, like, phases to put me through of things
Mm,
I'm hyper fixating on.
I relate to that.
Yes, and when I'm in this, like, you could even call it, like, an era, because it
Mhm.
lasts for, like, a year. When I'm in this era, that's all I can think
Arrow.
about. No, literally.
My brain just processed that. That's so good.
So, like, sophomore almost all of sophomore year, my major fear was passing out.
Oh.
You go down the spiral of, well, then you're anxious, and then your breathing can be quickened and shortened, and
Yeah.
then suddenly you do feel like you're gonna pass out,
Yeah.
and you're anxious about passing out,
Yeah.
and it gets worse.
Yeah.
Junior year, also, I never passed out. I found out that a medication I was taking for something completely different, it was, like, dermatological,
Okay.
was severely dehydrating me, and
Oh,
that
shoot.
contributed.
Okay.
But, then my junior year era was being afraid of anaphylaxis, which,
What
is
is
when you have a allergic reaction
Okay.
and, like, your throat closes up.
Wait, what are you allergic to?
Nothing. Bella, I'm so serious. No,
Stop.
there was an incident. We call it all my friends know about this. We call it the agave margarita incident.
Oh,
And
no.
what happened was I was having an agave margarita
Uh-huh.
and my tongue started to tingle
Mhm.
like 20%. Like nothing intense, but like my tongue was tingling and I was
Yeah.
like, I'm not the one. Um and I thought and maybe I was slightly allergic to something in that agave
Yeah.
margarita. But literally my anxiety disorder is so bad that for the next year, anytime I ate something new or just I didn't recognize, I literally, like, would feel my actual throat closing up.
Anxiety can do the
And
throat closing
anxiety
is
can do that.
terrifying.
Yes,
Yeah.
yes, for obvious reasons.
Yeah.
And then my current era is heart problems, which I don't have. Also can be a huge actual symptom of anxiety,
Yeah.
not relating to your heart. You can get chest pain.
I relate to that one big time.
Yes, and I
Yeah.
have to plug this on the podcast, but, I spoke with my physician about it, and she gave me a ton of advice in how to detect, uh, like, an actual heart problem,
Yes.
and I'm not a doctor. Talk to your own doctor about if you're concerned about anything, talk to your doctor, although
Unless
I
Josie's smarter than them.
I hate that I just said that because whenever I listen to podcasts and I hear, "If anything's wrong, talk to a doctor," I would start, like, hyperventilating
Oh, no.
and be like, "Oh my god, you know what? I think something is
Oh,
wrong."
don't worry, I'll put a trigger warning on this.
Perfect. But one of them that my doctor told me, I'm not a doctor, don't take this advice if you don't want to, but if you have a chest pain and you push on it with, like, your palms, like the heel of your hand, and the pain gets worse or changes, then that's evidence that it's not actually your heart. It's like
Yes.
the muscles or skeletal, the nerves, whatever other stuff is going on in your chest and not the thing keeping you alive. So I just had to share that because that was, dare I say, life changing for me to hear
No, it
that.
was life-changing when you told me that too. I was like,
Yes.
it actually does help the pain a lot.
Yes,
Yeah,
and
it's
a lot of
huge.
time that pain you feel is tension. like your muscles tensing in your
Yeah.
chest and pushing on it actually, like think about like a massage.
Yeah.
This is just me talking, by the way. Not a doctor. But this is just me talking, is that it feels like you can kind of get that tension to release when you push on it like a
Yes.
massage.
Mhm.
So yeah, again, kind of a long spiel from me. Health anxiety sucks. Bella and
Yeah.
I text each other all the time.
Yeah.
Um, one thing that's about health anxiety and other stuff, but one thing that's helpful for me is when I get a text from one of my friends, sometimes Bella, saying like, "Hey, I just want to let you know I think I'm having a heart attack." It's so easy for me as a third party to be like, "Well, look at Bella, she's so healthy, like, she has anxiety, clearly she's not having a heart attack." And then that kinda gives me perspective to when I'm the one who's like, "No,
Yeah.
this is actually happening." Because then it's like, think of it from a third person's
Yes,
perspective.
that's a huge anxiety and just, like, emotional regulation tip that I've, like,
Mm,
recently learned is looking at it from a third person perspective
mm,
is super beneficial. Yeah,
yeah.
definitely. One more thing I wanted to add regarding the health anxiety, and then unfortunately we are running out of time, so we'll wrap this up, is I also relate to the throat closing feeling, but for a completely different cause. And so it's interesting that we both experience that throat closing symptom, like that anxiety symptom. But for me, it was because I have large tonsils. And one time I went to the doctor and they were like, "Have you ever seen an ENT for those?" And that sent me into a huge spiral because I was like, I am like, how old was I at the time? Maybe 19, 20. And I was like, I've never gone to an ENT before. Why is this something coming up now?
Which, by the way, I'm is a like a throat specialist for our
Yes.
listeners.
Oh, yes.
Yes.
Ear, nose, and throat is what it stands for.
Yes.
Sorry. Yeah. So she had asked me if I had ever gone to an ENT, and I was like, well, no. And she's like, well, your tonsils are really big. Maybe you should do that. That led me into a vicious cycle of going to three different ENTs, went to one of them more than once. Every time I worked out, I would freak out that my throat was closing, that I couldn't breathe because of my tonsils. So similar symptom, different cause.
Mhm.
Interesting how it all manifests from the anxiety, though.
Yes. One thing I wanna add really quick on
Mhm.
that is if you're someone with health anxiety, this I cannot recommend enough, advocate for yourself in any doctor's office.
Yes, that's huge.
I, of course, developed a huge anxiety around dentists, and we don't have time for that story, but even if I'm going in for a simple teeth cleaning, I stop the hygienist and I'm like, and you don't have to be this dramatic about it, I'm just dramatic, but I go, "Listen, I have diagnosed health anxiety," which is true because it falls under GAD,
Mhm, yeah.
and I go, like, "If you" I word it differently based on the situation, but basically I just warn them, like, "If you say anything, that could panic me, I could panic." And I'm more eloquent, and it's better for the situation, but, like, when I'm at the dentist, I'll be like, "So try not to gasp too loudly when you're looking at something in my mouth." Something Bella, I once had a hygienist be like, "Oh my god, is this a bone fragment
Oh
next to
my
your tooth?"
gosh.
It was not. The dentist looked at it and she goes, "Oh, maybe you were eating a chip and it just like nicked you."
Oh my goodness.
And there I was being like, "Why do I have a bone fragment?" Anyway,
Yeah.
so to tie that together, in any medical setting, if you could be easily like, I guess, triggered, like
Yes.
Bella and I have been describing, definitely
Yes.
advocate for yourself, and if you can, do it beforehand.
Right. Yeah. One last thing I'll add and then we'll wrap it up, but that reminds me of one of the ENTs I saw immediately looks at my tonsils, immediately says, "Your tonsils are really big. You should probably get them out." Other 2 ENTs said that if I'm not getting frequent infections, I don't need to get them out. So it was just it's dependent on the doctor, obviously, and the professional, but the way that she approached her opinion was very triggering. And so I think it's huge to get yourself into the right headspace before going in for appointments if you are someone who experiences that, like Josie was saying. So,
Mhm.
yeah. But I think that's everything, unfortunately. We might have to do a part 2 of
Honestly, I'm
this.
having a lot of fun. I would not
Yeah.
be mad if you asked me back.
Honestly, I would love that. That'd be awesome. Well, thank you so much for coming on.
Yes,
This was
thank you
such a
for
great
having me.
conversation.
Yes, hopefully I didn't yap too much for the
No, not at
listeners.
all. Oh my gosh. Yapping is encouraged. Okay, well, thank you guys so much for listening. Yeah, I hope you have a great rest of your day. Love you. Mwah.